Yeah, I'm just going to step out of the room now, and I'm going to allow Audrey and the chairman to go ahead and take over. Thank you.
Okay. Thank you, Nadine, and thank you, everyone. Hello, and I want to welcome all attending the RTA's first ever virtual meeting of the Board of Directors. I want to remind everybody to please turn off or close your computer camera unless you want everyone in the world to see what your surroundings are like and whether you're wearing the proper attire. As you've all been made aware, due to the current COVID-19 pandemic and pursuant to Governor Pritzker's executive orders declaring a public health emergency, we've been given permission to conduct our meeting without the physical attendance requirements required in the Open Meetings Act. Now, I want to review some of the guidelines for this virtual meeting. The first is keep your audio on mute as much as possible in order to minimize the background noise, which may impair the recording and the transmission of this meeting. When you have a question or comment, please raise your virtual hand. Audrey will call on board members who have raised their hands one at a time. You can see who wants to ask a question. When the secretary calls on you, state your name before beginning so that the comments can be accurately reflected on the record and for the purposes of keeping our minutes. When we get to voting, if you wish to make a motion or a second, clearly state your name and your intention, and Audrey will repeat it for the record. Unlike normal meetings, when I don't see the right hands, I just can't call on somebody like a law professor. Today you got to raise your virtual hand so Audrey can call on you. It's a bit of a challenge, but the good news is that technology and the RTA staff have made it possible for us to continue to conduct business and support essential public services of our region. Does anybody have any questions about this procedure? If you do, raise your hand right now. With that said, I will now call the meeting of the Board of Directors of the Regional Transportation Authority to order. Normally, we would rise for the Pledge of Allegiance, but since we are in a virtual world this morning, we'll dispense with the pledge, but I do ask that everybody keep America in mind and that we're all one country. Will the Secretary, Madam Secretary Audrey, will you please call the roll?
Yes, and at this time, I'm going to ask everybody to just unmute so we can just go through the roll quickly. And when I call your name, just give me your presence. Director Andolfo? Director Carey?
Present.
Director Colson?
Present.
Director Frega?
Here.
Director Fuentes?
Here.
Director Groven?
Here.
Director Higgins?
Here.
Director Holt? Present. Director Cotel?
Here.
Director Lewis?
Here.
Director Melvin?
Present.
Director Payne?
Here.
Director Ross?
Here.
Director Sager?
Here.
Director Triani?
Here.
Chairman Dillard?
Present.
We have a quorum of 16 present and no absent.
Thank you, and thank you, everyone. You all will get a certificate that you are computer wizards, but I specifically want to thank the staff. We went through a couple, for the public who's listening, we went through a number of virtual runs. We actually had a couple of practice sessions to make sure our technology worked, but I really want to give the staff a big shout out because as easy and as seamless as hopefully this will seem over the next 45 minutes to an hour, it's not as easy as it looks in this virtual world. And the board, you, as always, are troopers for your basically almost always 100% attendance. Our first item of business is item 3A, and that's the approval of the minutes from the meeting held on February 20th, 2020. If there are any questions, let me know, but if there's no corrections, I'm going to ask for a motion in a second. So somebody raise their hand, and Madam Secretary will let me know who's
Director
making the
Cotel
motion.
motions, and Director Higgins seconds.
Thank you. Any questions or comments on that? Seeing none, Madam Secretary, why don't you take a roll call on this one, and that way we'll have a baseline roll call to work off of throughout the morning, so it makes it easier.
All righty. Director Indalcio? Director Carey?
Aye.
Director Colson?
Yes.
Director Frega?
Yes.
Director Fuentes?
Aye.
Director Groden?
Yes.
Director Higgins?
Aye.
Director Holt?
Yes.
Director Cotel?
Aye.
Director Lewis?
Yes.
Director Melvin?
Yes.
Director Payne?
Yes.
Director Ross?
Yes.
Director Sauger?
Yes.
Director Troyani?
Yes.
Chairman Dillard? Chairman Dillard? Chairman Dillard?
Yes. Thank you.
Okay. Oh, we lost you there. 16 ayes?
Thank you. Yeah, no, it's just, there was a little hold there. Next is, and that obviously is passed. Next is item 4, which is the public comment segment of the meeting. We've asked the public to submit their comments via electronic mail, and any comments received will now be read into the record. We just have one public comment. Is that correct, Madam Secretary?
This is correct. Go ahead, Chairman.
Go ahead and read it in if you would. It'll probably take about 3 minutes or so.
Yes. This is a public comment from the Active Transportation Alliance, the Center for Neighborhood Technology, Elevated Chicago, Illinois Environmental Council, Metropolitan Planning Council, Respiratory Health Association, Shared Use Mobility Center, and the Sierra Club of Chicago. Okay, thank you for your hard work and service during these difficult times. The COVID-19 pandemic presents enormous challenges for RTA, CTA, Metra, and PACE. Agency staff is working tirelessly to overcome these challenges and keep our buses and trains moving safely for essential workers. In the present chaos and uncertainty, agencies are starting to plan for how our region's transit system will work in the post-shelter-in-place and COVID-19 world. But they can't do it alone. As representatives of Chicago's business, civic, and academic communities, we are committed to advocating for public transit during and after the COVID-19 pandemic. This includes advocating for emergency assistance funding and reform in Springfield and Washington, addressing the needs of essential workers riding and operating public transit to sustain our regional economy under extraordinary circumstances, and preparing our transit system to be a driver of health and economic resilience during our region's recovery from the pandemic and its fallout. We recognize this is not a short-term crisis for Chicago Transit that will go away when the stay-at-home order is lifted and social distancing guidelines ease. The financial impact will ripple for many months and years as more Chicagoans continue to work from home and remain weary of buses and trains. This crisis forces us to rethink how we view public transit and reevaluate our regional goals with racial equity and public health outcomes at the center. Ridership cannot and should not be the primary metric for evaluation. Transit is a public good that is essential to sustaining and reviving our regional economy, even if far fewer people are riding. Low-income Chicagoans who rely on transit to get around during and after this crisis, many of whom are Black and brown, are providing services that are critical to meeting basic needs. We recognize many of the current funding sources and formulas for transit are linked to ridership and colorblind beyond federal civil rights obligations, but now is the time to begin to change that at the local, state, and federal level. Access to jobs and services with a focus on people of color and low-income residents is a better way to measure transit's effectiveness. We call on RTA, CTA, Metro, and PACE to establish an equitable, clear, and transparent process to engage stakeholders and the public in the planning process for the regional transit system's response to COVID-19. This includes spending decisions associated with the recent federal CARES Act and any future stimulus and transportation funding bills. It also involved developing a shared legislative agenda to advocate for Chicagoland public transit in Springfield and Washington. Following is a list of some immediate, near-term, and midterm strategies for discussion and cooperation. This is not intended to be an exhaustive list. We suggest setting up working groups with civic, academic, business, and community representation around these and other topics as soon as possible. We appreciate consideration of these topics and look forward to working together to make transit strong for the entire Chicago region. The immediate needs: maintain critical mass transit routes. Service boards should work with public health officials to identify key routes to essential services such as healthcare, grocery stores, etc., and if necessary, increase service to allow for social distancing on these routes. Service should immediately be increased on routes where crowding occurs consistently and social distancing isn't possible. Given the racial disparities in COVID-19 cases and deaths, racial equity must be prioritized in any service changes. Working with other agencies to address walkability and accessibility from and to transit stops, especially those nearby essential services like grocery stores, pharmacies, clinics, and hospitals, should also be an area of focus. Protect frontline transit workers, many of whom are people of color and being hit hard by COVID-19. In cooperation with transit operators, improve the safety of mass transit workforce by providing masks and other necessary PPE, making tests available for workers who need them, identifying and addressing air quality issues related to filtration and ventilation, providing hazard pay to maintain the workforce, etc. Prioritize safety for riders. Continue to identify and implement best practices nationally and globally for regular cleaning, boarding processes, distancing on vehicles, rear boarding, etc., and position transit assets as hubs for health by using stops, vehicles, and facilities as places for the dissemination of information and public health resources. Evaluate and enhance accessibility for riders with disabilities. Work with the disability rights community to identify needs and implement improvements. Ensure that new transportation policies, even temporary ones, do not discriminate against people with disabilities, that service changes are communicated clearly, and that paratransit access is maintained even if fixed routes are changed. Develop unified fare policy. Define and communicate consistent fare policies among all transit providers, including enforcement policies. Consider free CTA and PACE bus fares for the duration of the stay-at-home order and subsidize reduced fare programs for low-income riders for the long term. Share relevant data publicly. Service boards should make real-time data feeds and timely ridership reports available to the public for possible analysis of racial equity, geographic distribution, etc. Establish a data working group to identify specific needs and projects. Improve rider communications. Service Board should provide real-time updates to riders and the public above service adjustments due to crowding and other safety concerns using a variety of communication platforms. Information should be available to the public in accessible ways and in multiple languages, including signs, social media feeds, and the news media. Phone and text updates should be explored for riders without a smartphone access. Apply a racial equity lens and provide transparency on stimulus spending. Make plans and criteria for spending federal stimulus dollars publicly available and open for public comment. Optimize debt policies across agencies. Address questions about whether RTA should borrow to maintain service capital programs, whether it's preferable to flood the market with debt from more than one agency, etc. The near-term objective, the next few months. Pursue state legislative changes. Make changes to state law and RTA regulations that would help service boards maintain service, including operating revenue flow changes, perhaps via Illinois General Assembly, temporary suspension or lasting changes to the fare box recovery ratio, etc. Consistently evaluate service. Rebalance service schedules and routes among all three agencies to maintain geographic and temporal service coverage with an equity lens given the racial disparities in COVID-19 cases and deaths. Promote cross-agency coordination. RTA and Service Board should consider ideas like sharing vehicles, PACE and Metra, and workforce if we face a shortage. Maintenance prioritization, if one agency has more resources to clean, maintain an asset, then allow them to do it for the other agencies. Consider service coordination across agencies, such as identifying routes where a Metra train could replace or supplement bus service or vice versa, etc. Strengthen collaboration with local government agencies, especially those involved in planning and public health. Developers and community-based groups to reinforce current transit-oriented development efforts. Stimulus dollars and other sources of funding for the infrastructure should contribute to the growth of equitable TOD across our region. Transparently identify needs. Provide relevant information and updates on agency needs, including sharing the additional cost to each service board due to crisis. Establish robust community engagement principles and processes. In order to recover from this crisis and generate community support for transit, we need to go beyond providing information and soliciting public comment and fully and meaningfully engage riders and the community at large in public transportation decision-making. Formulate policies responses to likely contact tracing protocols put in place to limit spread of COVID-19. Begin planning to determine role transit will play, if any, in a region-wide test or tracing system. Formulate federal transportation policy. Develop shared regional agenda for federal stimulus and infrastructure bills, and a possible reauthorization of the federal transportation program. Identify funding needs for operations in key areas for regulatory relief, etc. Communicate clearly and accurately in a timely manner. At the beginning of the COVID-19 crisis, the Metropolitan Transit Authority in New York publicly explained their efforts to increase bus and subway cleaning. But CTA said no increased cleaning was required. Our transit agencies will need to do better if they are going to persuade passengers to return. Review capital project plans. Identify critical capital projects that can be expedited while ridership traffic is light. Consider elevating projects in areas of the region with larger numbers of essential workers and lower income riders. Prioritize equity-focused investments in areas with significant Black-brown populations. Moving on to the midterm objectives, which are within 1 year. Conduct public awareness campaigns with a focus on communities of color. Develop culturally competent marketing and education campaigns on taking transit. Research transit's impact on COVID-19 spread and its role in promoting public health recovery. conduct research on whether mass transit has contributed to transmission in any meaningful way, and learn from other regions, nationally and globally, how their transit agencies collaborate with public health partners to control and end pandemics. Pursue coordinated pilot programs. Implement pilot demonstration projects that foster and showcase nimble operations and coordination, including a demonstration program involving the Metro Electric and Rock Island corridors with lower fares and easier transfers to other transit and mobility options, and enhanced service on Chicago's South Side and South suburbs. Update long-term capital programs. Complete development of new performance-based planning process for transit capital investments. Reprioritize capital program in light of reduced revenues in a way that is transparent and data-driven by avoiding political decisions on capital projects in a constrained fiscal environment. Strengthen emissions reduction efforts. As COVID-19 deaths are exacerbated by air pollution exposure and climate change remains a long-term threat to the region, future planning and procurement decisions should prioritize moving away from fossil fuel dependency and toward zero-emission technology. Agencies should continue to work to obtain additional zero-emission vehicle funding from federal and state sources, including but not limited to the VW settlement and state capital funds for electric vehicle charging infrastructure. Review and enhance plans for transit-oriented development with a focus on racial equity and public health. Work with residents and equitable TOD stakeholders like Elevated Chicago to prioritize development in the areas hardest hit by COVID-19 and low-income communities of color across the region, ensuring that new development does not contribute to community displacement. Revise regional transit goals. Review and update goals and metrics in RTA, CTA, Metra, and PACE strategic plans and CMAP's On to 2050 regional plan, including our current regional goal to double public transit ridership. That concludes the public comment.
Thank you, and I thank them for those very comprehensive and inclusive remarks. So we will move on to item 5, which is the Executive Director's report from Leanne Redden. Morning, Leanne.
Unmuting, I am here. Good morning, everybody. Thanks for working with us and joining us for the meeting today. Okay, we've got my slides up. Good. Thank you. So I'll start, as I always do. If we can go to the next slide. Thank you. Where I always begin. Uh-oh. Well, I'll wait while they're pulling up the screen again. So before I get into sort of a summary of our COVID-19 response items, let's go through some of the general housekeeping stuff that we normally go through. So if we can go to the next slide, Jerry, when you get a chance, thanks. Through the end of March, the state owes the RTA $234.2 million in a combination of the ASA, AFA, and PTF funding. So that, as everyone knows, that's the combination of debt service that the state reimburses us for and the public transportation fund dollars. The state, at the end of March, is 9 months behind on the ASA and AFA side, and they're behind the equivalent of about 4.1 months on the PTF. The year-to-date short-term debt cost for us is $1.4 million, and this is just for March, through March, I should say. So now let's sort of turn our focus and switch to the next slide and turn our focus to the COVID-19 issue. So as I think a huge understatement, this is an unusual time for all of us, and I think we can agree that this virtual board meeting is the least of the challenges that we're facing. So whether it's been working from home for the first time or having to toggle between, working remotely, overseeing children e-learning, life for all of us has changed. And I think it's more important, the more important issue for all of us is to keep in mind that this is a deadly pandemic, and it has changed not just our daily lives, but the global lives too, for everybody to a large degree. The RTA's top priority is always the health and safety of our agency employees, our customers, contractors and vendors. And so therefore, as I've notified you previously, on March 16th, RTA staff began working remotely. So in terms of the services we're providing, the following have been suspended, and our downtown offices are closed until further notice, based on changes in the public health situation and tied to COVID-19. So the RTA Customer Service Office is physically closed. The RTA Travel Training Program and the ADA Paratransit Certification Programs offices are closed. It is still possible to apply for reduced fare and free ride permits. Information for all of this is located on our website, and the RTA staff can be reached at the 312-913-3110 phone number. Customers needing information about travel training and ADA paratransit certification can flow. Sometimes it adds a little bit of context and some levity to the work that we're doing. But in all, we've been able to keep really focused, and which is really provide the work that we do, stay home, stay healthy, and support the services of the transit services as much as we can. For the past month, the RTA and service boards have been in continuous and coordinated communication with the Governor's Office. And what we're primarily doing is providing them coordinated one-stop shopping for updates on, the transit agency's responses, from health and safety responses to operational responses, as well as providing them data on the operational and financial impacts that the crisis is having. While each of the service boards has seen a dramatic decrease as a result of the state stay-home order, public transit remains an essential service responsible for transporting healthcare employees, emergency workers, and retail workers throughout the entire region. And throughout this time period, the RTA and the service boards have been committed to passenger safety and worker safety. I'd like to thank specifically the service board leadership, all their staff, especially their frontline workers, who really stepped up and served the community as this pandemic has unfolded. The RTA is providing weekly documentation to the board, and please look for those emails, and same distribution of information to elected officials with descriptions of the preventative measures taken by each service board, as well as details regarding additional information about service board operations can be found on their websites. We also plan to keep updating you on a weekly basis with any new developments, including ongoing reports on regional ridership stats and revenue shortfalls. We're sharing that information with elected and appointed officials around the region also, as well as our congressional delegation. So in terms of state legislative action, the Illinois General Assembly has not been in session since early March, and it is likely that neither chamber will return to session until sometime in May. At the end of the state fiscal year is June 30, and some short-term or long-term budget would have to be passed in order to keep some of the aspects of the government funded beyond that point. So the House and the Senate have formed working committees to examine the potential of state budgetary impacts of COVID-19 and are making recommendations regarding future funding and policy. A capital and infrastructure group has also been formed, both in the House and Senate, and we're remaining engaged in discussions with the legislators from both chambers, as well as the RTA and the service boards. We're working closely with Illinois' congressional delegation as Washington began to respond to the COVID-19 crisis. Actually, the chairman, Jeremy, and myself were there basically right before everything started to shut down. And during the week of March 16th, after the passage of two smaller legislative measures that were focused on immediate health and unemployment impacts of the coronavirus, right after that, Congress and the administration were in negotiations developing an expansive funding bill. On March 27, a $2 trillion funding bill entitled the CARES Act was signed into law, and the bill contained $25 billion of additional dollars for COVID-19 related funding for transit nationwide, and that was unprecedented. Over $13 billion of transit funding went into what they call the Urbanized Area Formula Program, and over $7 billion went into the State of Good Repair Formula Program. So after the apportionments and allocations, this results across the nation, this resulted, and even regionally, this resulted in a $1.4 billion of supplemental funding for the RTA region. So unlike traditional federal formula funds, the CARES Act is to remain available until it's fully expended. And the funding under the CARES Act can go towards reimbursement for operating costs to maintain service and to support or to fill the gap of lost revenue due to the coronavirus. And I think most of you know already, we really don't receive operating funding from the Fed. So this is all new territory for all of us. So on to the next slide, which talks about the allocation of the monies coming to our area. So focusing on the region's portion of this emergency relief funding, the RTA has discussed with the service boards the allocation of the Northeastern Illinois funding based on the following principles. So at this time, the CARES Act funding is the only known source of supplemental operating funding for transit to alleviate long-term financial impact of COVID-19. And so I just add a little additional comment there. So while we are hearing about potential additional relief packages being passed by Congress, we can't count that anything, and actually some of my conversations with the delegation have been that this could very likely be it for transit. There is talk of potential some capital relief, but that's still to be determined and could be a long way off. Back to the original principles, though, that we've been thinking about in terms of how we allocate these dollars. The funding should also be allocated by a data-driven approach. And more funding and operation changes will likely be needed as those discussions continue as we fairly quickly, basically on a parallel path, begin the planning for the 2021 budget. So as a result of the region's transit funding allocations, they'll be based on anticipated revenue shortages of the current 2020 regional budget that we've been able to project, and agreed to by the RTA and the service boards, and are based on ridership and public funding shortfalls. So all of us across all four agencies have been sort of working diligently on identifying that and coming up with these gaps and what these needs are. So it is proposed that the funding of the region's shares of the CARES Act should be allocated among the RTA and the service boards in the following manner. I'm actually going to read the numbers, so for those of people who may not be able to see slides or just listening to this. So the total funding for the Illinois region is, for our northeastern Illinois region, is $458.65 to be precise. So across the service boards, CTA, the allocation to CTA is to be $817,487,350. Metra, $479,216,722. PACE, $112,756,875 million. Again, the split among the service boards is based on the financial modeling done by both the RTA and the service board staff. These are the best estimates that we can provide at this time, and we will continue to monitor those numbers though. While the impact of the governor's stay-at-home order on ridership could be basically immediately observed and measured since mid-March, we won't know the impact of the COVID-19 on our sales tax receipts, even our March sales tax receipts, until June, due to the regular delay in disbursement of that. And given the unprecedented nature of the pandemic, these estimates are the best data available. So the impact of the COVID-19 pandemic is projected to result in an average year-over-year decline in region-wide sales tax receipts of estimated at 27.8%. This includes a 25% decline in March, followed by a 50% reduction during the entirety of the second quarter. Our model reflects a partial recovery during the third quarter. And again, these are numbers predicted by the service boards, not just us. And then a resurgence of a decline in the parts of the fourth quarter of 2020, and the experts tend to believe that this will be caused by a potential resurgence of the virus that could very likely occur during the fall months. So any decline in sales tax that would have an impact on the RTA's sale of state funding, which is tied by formula to the amount of revenue generated by the RTA sales tax. So following the statutory allocations and the general funding framework, these sales tax and state funding reductions would result in more than a $500 million less service board funding in 2020. So each service board provided the RTA with projected ridership loss and resulting loss of fare revenue for 2020. Estimated revised fare revenue levels across the region are nearly $500 million less than we predicted, and about that translates to about a $1 billion less of fare revenue for the 2020 budget. So over the course of the year, each of the service boards expects approximately a 50% decline in fare revenue, and the depth and the duration of this initial loss and the rate and degree of recovery differs by agency. So the combined projected losses of service board funding and fare revenue for mainline service total more than $900 million for this fiscal year. Nonetheless, we do not yet know the extent of the full financial impacts of COVID-19 and what it will do to our region's finances, and it is very likely that the impact will be felt far beyond this immediate fiscal year. And I don't think it's a very likely, I think it's a given that it will be into 2021 at least. Consequently, the CARES Act funding should not necessarily be looked at supplemental funding for just 2020. The RTA and the service boards need to be planning for the long-term regional financial impacts of the virus when drawing down on these funds. So at today's meeting, one of the action items, you'll be asked to approve the funding allocations to northwestern Indiana, southeastern Wisconsin, and then the region's share, so we can initiate the process for accessing those funds from the FTA as soon as possible. At a future meeting, the RTA board will ask the RTA board to consider actions that will reflect the agreed upon projected revenue shortages for the remainder of the fiscal year, as well as recognizing and incorporating the new supplemental operational federal funding coming in, being made available through the CARES Act. So additionally, at a future meeting, the RTA will likely consider an amendment to the region's 2-year financial plan that will reflect the agreed upon projected revenue shortages for the 2-year period, as well as the funding made through the CARES Act. So I know that sounds kind of administrative, and I know I've spoken with several of you independently. You know, there's no game rules for any of this, including how to deal with a pandemic, and even down to how this money is coming to us and flowing to us. You know, they're flowing this through federal capital programs, and so, but we're being asked to allocate them in an operating way, for operating costs. And so we have to reconcile all these things. Some of that is bureaucratic, but we have to make sure we're sort of following the law, both at the federal level and the state level. But we also, on a parallel path, wanted to make sure that we were providing full access to those dollars and no impediment for the service boards to be able to access and draw down on those dollars as soon as possible. So that was long, but that completes my report, and we'll get into a little bit more of those details of some of those items in the action items, but I'd be happy to answer any questions if anyone has any.
Anybody have any questions?
Director Higgins has a question. Unmute yourself, please.
Yes, hi, thank you. One of the factors that you had said was used in coming up with the allocation was changes in ridership relative to budget. I'm curious, you know, some of the service boards historically do better budgeting changes in ridership, and wanted to make sure that you're comfortable that we haven't penalized any service board with this allocation that actually had a realistic ridership measure as opposed to something that may have been overly confident for 2020.
Yeah, well, just to clarify, actually, where the projections are being we're working off real loss of revenue. When we're looking out further, that's sort of how we've overarchingly sort of allocated the dollars. But, you know, we're going forward, you know, we're actually tracking against real loss of revenue. And just to clarify, this is a sort of a weedy nuance, but even when the service boards apply and start accessing those dollars at the federal level, it's a reimbursable expense. So they basically kind of have an overarching grant, and then they have to submit actual expenses or losses of expenses and or losses of revenue to the feds, and then they reimburse them that amount. So there's an accounting for that as well.
Thank you.
Director Melvin, please unmute. Unmute. Oh, there you go.
Thank you. Thank you. Can you hear me now?
Yes.
Okay, great. Thank you. Just a question. I may have misunderstood something, but is there an assumption in here that the virus returns? Did I hear that correctly?
Well, I think that this is not coming from us. This is from the healthcare experts, you know, locally and nationally. There is some, well, we've seen it happen around the rest of the world where you open up and maybe relax some of the social distancing, open up some businesses. There tends to be sometimes a bit of a resurgence of the virus. Additionally, there's some uncertainty around the climate impact, and so the thought being, if schools go back in the fall, if people more are back at work, there could be, again, a slight resurgence of the virus kind of picking up a little. So we're, you know, working that estimate in, but that's based on medical experts, not based on us.
Thank you.
I see no more hands.
Great.
Back to you, Chairman.
Yep, thank you, Leanne. And everyone. We'll move on to item 6, which is the monthly financial results for February. B, you want to give us this great news?
Good morning, Mr. Chairman and members of the board. Today I will cover the first financial results for the 2020 budget year. Instead of navigating through the dashboard like we normally do, for simplicity's sake, we are only displaying the summary page. I'll keep my remarks brief because obviously it is a very different picture than what we're going to see once I present the March results next month. I'll follow up to Director Groven's or Director Higgins' question. When we look at ridership, we were actually doing really well, as you can see on the slide. So I think all of the service boards have been much more realistic in their ridership projections. And you'll see that, you saw that in January, you'll see that in February, but obviously March will be a completely different story. And when we looked at their fare revenue losses, we compared their actual numbers to their budgeted numbers, which as I said, were actually faring very well. So we do think it's realistic. We will ask you to consider 2020 budget actions in the future, and it is important that we remember that we started the year with 2 very solid months before the onset of COVID-19. Through February, ridership has reversed the trend we reported most of last year and finished this 2-month period favorable to budget by 2.4%, as shown in the lower right section of the slide. Each service board reported favorable ridership results, and 88 paratransit is highlighted with almost a 6% higher ridership than budgeted, likely due to the relatively mild winter weather. The favorable ridership results kept system operating revenue, shown in the upper left section of the slide, close to budget, with 88 paratransit highlighted again due to favorable fare revenue. In the middle left section of the page, we have the public funding results. While January sales tax will be coming in about 8% higher than the polar vortex January of 2019, that result was slightly below budget. Notably, the real estate transfer tax got off to a bad start in 2020 with very poor results in both January and February, which resulted in the only red box on this month's dashboard. Service board expense performance, which is in the lower left section, was also good, again aided by virtually snow-free winter. Metro and Pace are highlighted with good performance across all expense categories. 88 paratransit expenses were 1.3% higher than budget, but again, that is due to increased rates. Now moving to the upper right section where we see mixed net results for the service boards. CTA's public funding shortfall contributed to an unfavorable net result variance of $8 million, while good expense performance at Metro and Pace produced net result variances of more than 3% favorable, highlighted in light blue. When you look at the middle right section showing that Metro's recovery ratio was favorable to budget by almost 4 points due to good revenue and expense performance. The regional recovery ratio was more than 1 point favorable to budget through February, but it is poised to plunge in March. So looking ahead, ridership fell sharply after the governor's stay-at-home order, which took effect on March 14th. Fare revenue losses at the service boards were immediate and have accelerated in April as virus mitigation efforts continue. Tomorrow, the RTA will be distributing a supplemental advanced public transportation fund payment of approximately $35.4 million to the service boards in the amount of each agency's estimated March fare revenue. The amounts will be deducted from future public transportation fund-based distributions after each agency begins receiving the Corona Aid, Relief, and Economic Security, or CARES Act fund, which will be for the actual March fare revenue losses. Next month, the March year-to-date results will show the service board and regional recovery ratios on a downward trajectory. Knowing this, we will need temporary recovery ratio relief for navigating the difficult months ahead. In summary, the February year-to-date results represent a solid state to a fiscal year which is going to end up looking very different than our 2020 budget represented. The challenges are unprecedented, but we are working very closely with the very competent service board finance teams to craft solutions to the many problems we suddenly face. That concludes my remarks, and I'll be happy to try to answer any questions. Thank you.
Thank you, Bea. Any questions or comments? Remember to use your hand-raising tool in WebEx so Audrey can see who wishes to speak.
Okay, I see no hands. Do any of the callers have a comment? Oh, Nadine?
Nadine, you have a question or anything?
Hello, everyone. This is Nadine. I just wanted to jump in with a quick tech tip for everyone. Please do not use the plus sign next to the words new whiteboard in order to increase your screen size. That actually takes over the presentation. I was just pointing that out for folks so that we could keep the presentation moving smoothly for the viewing public. Thank you.
Thanks, Nadine. We will move on to item 7, which includes items that require board action today. We'll hear from the staff on these items and vote on each one following staff remarks and any questions. The first is ordinance, or it's under item 7A, and that's ordinances authorizing the execution of 2020 federal funding allocation agreements between Northeastern Illinois and Northwestern Indiana and our buddies in Southeastern Wisconsin, and amending the 2020 to 2024 capital program and amending and extending ICE-funded projects. Jill, what do we need to know about this before we vote?
Good morning. Thank you, Mr. Chairman. I'm requesting approval of 3 ordinances related to the region's 5-year transit capital program. First, we are requesting your authorization to execute the full 2020 federal formula allocation attachments to the letter of understanding between Northeastern Illinois, Northwestern Indiana, and Southeastern Wisconsin. Second is an amendment of the 2020 to 2024 capital program incorporating changes in program revenues and expenses for CTA, Metra, and PACE. And third, a time extension for implementation of CTA, Metra, and PACE's Innovation, Coordination, and Enhancement, or ICE-funded projects. Let me walk you through the changes we are recommending in the first ordinance. On February 9th, 2020, the Federal Transit Administration published the 2020 full federal fiscal year allocations for the 4 federal formula programs, 5307, 5337, 5339, and 5310. The first 3 formula programs are funding capital projects. As you know, the RTA is the designated recipient of those funds and charged with the calculations of apportionments between Northeastern Illinois, Southeastern Wisconsin, and Northwestern Indiana. The Illinois portion of the capital funding is split between the service boards in accordance with historically established shares. The Section 5310 funds go directly to the RTA for competitive distribution within the region. Overall, the 2020 appropriations are a little over $524 million, a 3% decrease compared to the previous year, or $16.8 million less than the 2019 federal portions. To clarify, this funding is separate from the federal relief funding tied to operating funding that was passed as part of the CARES Act that Leanne spoke about in her ED report. That funding allocation will be covered in our next agenda item. The federal funding allocations were approved by the CMAP Policy Committee on March 12th. Today, we are asking for your approval of the ordinance and to execute the agreements with Indiana and Wisconsin Regional Planning Commissions, stating these funding allocations. Moving on to the second ordinance is the capital amendment. This quarter, we are asking you to approve a total net funding increase to the 5-year capital program of $62.78 million that affects both current and out years. The total net increase for CTA is $63.67 million, for Metra $1.1 million, and a decrease for PACE of $2 million. The total regional net increase includes about $86 million of additional federal discretionary funding, nearly $2 million in reprogrammed or carryover in service board local funds, and a decrease of nearly $25 million stemming from the FTA 2020 federal fiscal year allocations I just mentioned for the first ordinance. The project and budget changes in the capital program are included in the memo of your board materials and in the schedules 2A and 2B attached to that ordinance. And finally, onto the third ordinance, we are requesting your approval of the 12-month extension for 4 CTA, 2 Metra, and 2 PACE projects that are outlined in your board memo. RTA staff has reviewed these requests and found them to be justified as outlined in the ordinance request memo. I'm happy to answer any questions. Otherwise, we are seeking your approval of these 3 ordinances. Thank you.
Great. Any questions or comments? Please remember use the hand-raising tool in WebEx. Audrey, you see anything?
I see no hands. If anybody on the phone has a comment, state your name now. Okay, no questions.
Then let's have a motion and a second to approve this item as submitted.
Sorry, Alex Holt has a question.
No, Audrey, I was just responding to the chairman's request for a motion.
Oh, okay, so I have Director Holt
votes.
motions and Director Troiani seconds.
Thank you. If there's no objections, we will use leave for the attendance roll call. Does anybody have any objections?
Leave.
Hearing none, leave is granted. And Audrey, is this a 16-0 vote then in approval?
16-0 victory.
Thank you. So those 3 ordinances are approved under 7A. Let's move on to 7B, which is the ordinance authorizing the allocation of CARES Act funding. Jill, what do we need to know on this one?
Thanks, Mr. Chairman. As Leanne described in her ED report, on April 2nd, 2020, the U.S. Department of Transportation's Federal Transit Administration announced a total of $25 billion in federal funding allocations to help the nation's public transportation systems respond to the COVID-19 pandemic. Funding is provided through the CARES Act, enacted on March 27th, 2020. Staff is requesting board approval of an ordinance that authorizes the execution of federal formula funding allocations based on the letter of understanding agreements between our region and northwestern Indiana and between our region and southeastern Wisconsin. The agreements reflect the share of the region's CARES Act funding allocations for the following federal transit formula programs: Federal 5307 urbanized area, including 5340 growing and high-density state formula programs, and 5337 state of good repair. The Fixing America's Surface Transportation, or the FAST Act, authorizes federal transportation funding to the regional urbanized areas, and the CARES Act allocates funding through the same funding mechanism. The RTA, as the designated recipient of these federal formula programs, first sub-allocates the funding to northeastern Illinois, northwestern Indiana, and southeastern Wisconsin based on the U.S. Census and operating data for each region. The ordinance was amended and distributed to the board to include the funding allocations for our region, northeastern Illinois, as Leanne outlined in her executive director's report. The regional planning commissions of northwestern Indiana and southeastern Wisconsin have approved RTA's recommended CARES Act federal formula funding apportionment allocations. The CMAP Transportation Committee and NPO Policy Committee will also endorse the recommended allocations following RTA board approval, and we will also provide written notification to the Federal Transit Administration of the allocated capital federal funding to all recipients in the region. Today, we are seeking your approval of the ordinance to approve the 2020 CARES Act federal apportionments that includes 2 letters of understanding for Indiana and Wisconsin and the funding allocations for our region. I'm happy to try to respond to any questions. Otherwise, we're looking for your approval of this ordinance.
Thank you, Jill. Are there any questions or comments?
Director Sager has a question.
Motion to approve.
Thank you, Doctor.
Okay, and I have a second from Director Hotel.
Thank you, Tom. If I'm given leave again, let's do this unless someone has an objection. Is there leave for the attendance roll call on 7B, the CARES Act funding? Seeing no objection, leave is granted, and Audrey, I think that one is 16-0 as well, approval.
Correct.
Thank you, everyone. Let's move on to 7C, which is the ordinance authorizing the issuance of $250 million in RTA working cash notes. B?
Yes, this is B. Raina Hickey again. The staff requests that the board adopt an ordinance that authorizes the RTA to issue up to $250 million of working cash notes through a direct placement with a drawdown revolving feature with repayment over 2 years. The 2020 A series will retire the existing 2018 working cash notes of $150 million. The staff followed a competitive process, sending out our requests for term sheets to 39 firms. We received 5 responses. We began negotiations. Now, keep in mind that we were out there in February. This is business as usual. We believe that our role at the RTA is to provide a buffer to address delays in public transportation funding, sales taxes not laid, or delays in ASA and AFA, which is the debt service state subsidies. So we began negotiations with the 5 firms. We elected to move forward with JPM, and we will have retired as of May 6th, the 2018 series. So what we will have outstanding in short-term borrowing would be a total of $250 million with JP Morgan Chase for 2 years. We were originally going to do $150 million, but given the COVID situation, we decided to add another $100 million, again, to provide that buffer. And as I indicated earlier in the financial narrative presentation, our plan is to provide a supplemental ETF payment during April, as a matter of fact, tomorrow, to the service boards to help them through this cash flow situation until the CARES Act money begins to flow. Are there any questions on this particular ordinance?
If not,
I'm not seeing any hands raised.
how about a motion in a second, please?
Director Andalcio, just raised your hand. Unmute.
Motion to approve, sorry.
Okay. And I need a second. Director Cotel seconds this one as well.
Thank you. If we can, let's have leave for the attendance roll call on this. If there are no objections, is leave granted? Seeing no or hearing no objections and seeing no hands raised, Audrey, I declare that one approved. Also,
16 ayes.
Thank you. That motion, this one is approved. Next, moving right along, is 7D, an ordinance authorizing a contract amendment for board meeting services. B, anything we need to know other than what's in our reading materials on this one?
No, the staff requests that the board adopt this software, again, for the management of online delivery of board meeting documents. This is a 12-month extension and an additional $35,542.
Thank you. Any questions on this or comments? If not, can I have a motion in a second, please?
I have Director Cotel with the motion and Director Frega with a second.
Thank you. Can I have leave on this one as well? Hearing or seeing no objections, leave is granted, and this one will be so reported.
16 ayes.
Thank you, Audrey. Next is 7E, which is an ordinance authorizing an amendment to Project Management Services Task Force Order Number 3 for the support of the RTA's ERP implementation project. B or Leanne?
No, it's B, yes. This is B again. The staff requests that the board approve an ordinance provide additional project management support to the RTA for our ERP implementation. We're expecting a contract increase of $200,000. These contracts were competitively bid, a staff augmentation contracts a number of years ago, and what it requires is for us to come to the board when there are monies to be added to any of these contracts. We are on schedule to complete the ERP implementation in the fall, and we require this money to extend it through October. If there are any questions, I'll be happy to answer them.
Thank you. Any questions or comments?
I see no hands.
Excellent. How about a motion and a second to approve 7E?
I have a motion by Director Troiani and a second by Director Andalcio.
Thank you. Is there leave for the attendance roll call on this one? Seeing or hearing no objection, leave is granted. And Madam Secretary, this ordinance for the RTA's ERP implementation project is approved.
16 ayes.
Thank you. Next is 7F, which are the travel expense reimbursement for board members as required by law. As Leanne said in her report, I was out, and it was surreal toward the end of, right before the general stay-at-home orders in Washington. Walking through the U.S. Capitol building when it's closed is very eerie to meet with Senator Durbin and members of our congressional delegation. We met with Senator Duckworth as well, so it was surreal, and it's very surreal to have a flight back from Washington, D.C. with only 6 people on board, where the flight attendant says anybody can sit wherever they want to, please spread out. So with that, if there's no questions or comments, can I have a motion and a second to approve the travel reimbursement expenses as required?
Director Higgins moves. And
I second it.
Director Frega seconds.
Thank you. If there's no questions or comments, is leave granted for the attendance roll call? Hearing and seeing on the little hand raising, no objections. Leave on 7F is granted as well, and that's 16-0 also, Madam Secretary. Thank you.
Correct, 16 ayes.
Okay. I think that is going to essentially conclude our business. As a reminder, the next scheduled meeting date for the RTA board is Thursday, May 20th, beginning at 9 o'clock. We'll advise you to the location, or if we do it again, the virtual meeting nature as we get through today, as we get closer. And the status of COVID-19 crisis is updated. Until then, everybody stay healthy and safe.
Leanne has a comment.
Yeah, I just want to thank Leanne and all of the staff again and the board. You're all troopers, and we made it through this without a glitch, which is wonderful. Thank you. Leanne?
Just a minor clarification. I think you said May 20th, but the next board meeting is scheduled for Thursday, May 21. Just to clarify, especially for those leading.
I've got 20 in my notes, but it's May 21. Thank you for
Sorry.
clarifying.
My mistake.
All right.
So at this point,
if there's no further business to come before the public session of the Board of Directors, I'll entertain a motion and a second to adjourn. And please raise your hand or state your name so Audrey can clearly identify who is making the motion to adjourn.
Director Payne has moved and Director Ryan has seconded.
Thank you. I assume there is leave for adjournment, so it's approved 16-0. Again, thanks to everybody. Stay safe, stay healthy, and kudos again to the staff and all of you for making this a flawless virtual meeting. First one ever. Really appreciate it. Thanks, everybody.
Thank you. You can all disconnect.
Thanks, Chairman.
Thank you.
Thanks, guys, and ladies. It's been
Oh,
awesome.
very good.
Thank you.
Be safe, everyone.